sector. Aged care policy is not something that can be kicked down the road. It is in crisis already, and every demographer, anyone that goes out in their community, knows that it is only going to get worse in the years to come. There are around 1.3 million Australians currently receiving some form of aged care. There are around 400,000 nurses and carers administering the care to these Australians. By 2056, just 38 years away, the aged care workforce will need to triple. 1 in 4 Australians will require aged care by 2056. That's around 3.5 million older Australians. We need to get this mess fixed now, Deputy Speaker. So I support the Royal Commission into aged care. The horrors of abuse we have seen documented on Four Corners and elsewhere really is a national shame. And sadly, these are not just one-off incidents. We know that abuse is occurring widely and is still happening today. When the Minister for Senior Australians and Aged Care announced the Royal Commission, he asked members of parliament to engage with their communities and report what issues should be included in the terms of reference for the Royal Commission. Unfortunately, he only gave us a very short time frame, in fact just one weekend, but I emailed my constituents on the Friday afternoon and asked them to report back to me on the Monday. I was overwhelmed with the response just in that one weekend. Many Moreton constituents told me of their own experiences with their loved ones in aged care facilities. And, Deputy Speaker, this was heart-wrenching information. The same issues came out in emails and phone calls and letters over and over again. Staffing levels, the qualifications of staff, the standard of care, appropriate care for those living with dementia, the provision of medical care in residential aged care, the needs of the culturally and linguistically diverse residents, the affordability of aged care and funding arrangements, the transparency of provider performance and regular inspections of residential facilities, information about the choices available in aged care, and responsiveness to the allocation of home care packages and transitions between levels of aged care. This is a sector in deep crisis. A Royal Commission is welcome, but older Australians deserve this crisis to actually be fixed, not just recognised. The Morrison government needs to do its job and look after older Australians who need to access aged care. The Prime Minister has a particular responsibility because he was responsible for those deep cuts into this sector. The wait list for home care packages has now blown out to 121,000. These are older Australians who want to stay in their own home, thus saving money, people like my father. They are capable of staying in their own home with some support. But the longer they stay on the waiting list without the support they need, the more likely it is they will need residential aged care. Many older Australians are waiting more than 2 years for the home care package they have been approved for. This is disgraceful.